Hello guys, welcome back to my channel Ages Kingdom. In this class, I would like to take the topic from anatomy, physiology, endocrine system. Already pituitary gland I have explained, and from pituitary gland what are the hormones are releasing and controlling our body. I explained. From pituitary gland what is the major gland is responding and what is the major hormone is releasing. That is what we are going to discuss here. The topic is thyroid gland. The topic is thyroid gland, and when I speak about pituitary gland, I said it is a master gland, whereas this thyroid gland is the largest gland in the body, which really controls overall system of our body. And when I speak about anatomy, so here in this topic, just listen and write this running notes along with my explanation, because everything I am not able to put it in the board. So very important points only I am highlighting, but still I will give explanation for each and every topic, and in that you can take a running notes, and that content is enough. And this is also several times asked question for 5 marks or for 15 marks also. Then separately thyroid gland 15 marks, and they will ask classification of pituitary gland and write any one detail or write about the thyroid gland in detail. Means then you need to see at least you have write for 8 marks or 7 marks. Okay, so whenever you see the thyroid gland structure, when you open the textbook, they will show here in the neck. Everybody knows that the thyroid gland is located here. So when you speak here about the trachea, the cartilages are located, and in that anteriorly this thyroid gland is located. Anteriorly this thyroid gland is located, and just below the larynx, voice box, just below the voice box. So I am telling you the location is in anteriorly to the trachea and below the voice box, and it is extending from the fifth cervical vertebra. Fifth means when we speak about the vertebra, this is the skeletal system structure. So when we speak about vertebra, the first 7 we call it as a cervical. So the thyroid is extending from the fifth cervical, sixth cervical, seventh cervical, and up to first thoracic vertebra it is extended. So here I mentioned that it is located in anterior of the trachea, below the larynx, it's called voice box, and then it is extending from the fifth cervical vertebra in the location of posteriorly, and it is extending till the first thoracic vertebra. So that is the location of thyroid gland. When you see the diagram image, this image itself, so I am not able to draw the completely this thing like the trachea, rings are there. So it is located in the anterior portion of the trachea, and in this anterior portion of the trachea, when you see that image now you can understand. It looks like a butterfly shape usually, and it is also looking like a H or U shape. It is also looking like H or U shape. It's usually butterfly shape, and it is all one word answers. Please listen also. Butterfly shape and H or U shape. And the color will be almost all organs are in brownish color. When I speak about renal system also, I told you it is a brownish color, and it is brownish red gland. Brownish red gland, and it weighs about 25 grams. It weighs about 25 grams. Whereas when I speak about pituitary gland, it is a master gland, but this is the largest gland. So weightest also. So it is 25 grams weight is there. 25 grams weight is there. When you see this structure, it looks like the middle portion is connected with isthmus. The middle portion is connected with isthmus. On either side, we have 2 lobes. The lobes are 2. The lobes are 2. So this is about thyroid gland. Thyroid gland is the greatest gland in the endocrine system, and it is the largest gland. It is located in the neck region of below the larynx and anterior to the trachea, and brownish color. It weighs about 25 grams, and the location is from cervical vertebra to thoracic vertebra, and the lobes, 2 lobes are there. The middle portion is connected with the isthmus. And what is the major structure of this thyroid tissue is, we call it as a follicles. It forms like a colloids, it forms like a colloids, and it is looking like a follicles, and these follicles are helping for the catch up of T3, T4 cells and helps in effective work. And it is again, these follicles are divided into follicles, parafollicles and colloids. The tissues which are present in the thyroid gland, we call them as follicles, parafollicles and colloids. So this is about anatomy of thyroid gland, and it is releasing importantly two hormones, that is called T3 and T4. Everybody knows what is the level is increased, which level is increased, something and all they will say, isn't it? So usually from pituitary gland, it releases thyroid releasing hormone, and again from thyroid releasing hormone, then it releases thyroid stimulating hormone. From thyroid stimulating hormone, it reaches to the colloids and the tissues, and it stimulates the thyroid tissue to release T3 and T4 cells, and it is also releasing calcitonin also, that I will discuss later. It is mainly releasing of T3 and T4. The word itself, T3 means you just triiodothyronine. Triiodothyronine, and whereas T4 means tetra. Always everybody knows that the 4 means tetra. So tetraiodothyronine means that is T4. These T3 and T4 two hormones are released, and when it is calcitonin also is released, it helps in the maintenance of calcium balance in the body, and it helps to control the calcium levels, especially in the blood, and helps in equilibrium. So this is what we have to see. And when it comes to the blood supply, every time we will see now, when it comes to the blood supply, we have to speak about the arterial blood supply is superior and inferior arteries. Arterial supply is superior and inferior arteries. When it comes to the veins, same. When it comes to the vein, it is superior and inferior thyroid veins. Superior and inferior thyroid veins. So this is about the blood supply of thyroid gland. And next thing, what are the main functions of thyroid gland? What are the main functions of the thyroid gland? Because I told you this system, this thyroid gland is controlling whole body, whole systems, and a very important thing you need to remember, it helps in maintenance of vital signs. It is because it is working in thyroid gland, and it is working on cardiovascular system, respiratory system and renal system. So it is working on the kidney, heart and the lungs, and doing a very major role, helps in maintenance of vital signs and homeostasis, balance, either increasing heart rate or decreasing heart rate, or increasing respiratory and decreasing, or BP is increasing. This all is completely balanced by this gland alone. So if this gland is getting disturbed, then definitely almost all of our vital systems get disturbed. Because take an example of heart, it helps in increasing the cardiac output and reduces the cardiac workload, and at the same time it helps in heartbeat, let's call it as a heartbeat and blood pressure. And suppose if thyroid gland is increasing more, all these things will be increased, then we call it as a tachycardia, we call it as a hypertension, and we call it as sometimes the heart failure also can happen because of the prolonged pressure of this gland on the heart. So such kind of things will happen. So the first important function is it helps in maintenance of vital signs, especially it works on the vital organs like heart, lung and kidneys. So in case of lungs, it helps in good inspiration and expiration, and maintenance the breathing rate in a normal way. And even in the blood pressure also the same things will be, because when increasing heart rate is there, when cardiac overload is there, and when cardiac getting a more pressure, automatically palpitations and blood pressure also can occur. So that's the importance of this thing. And other things is, it is also helping for the growth of follicles in the sex gonads, because sometimes they say still even at the age of 20 if you are not attaining the menstruation, doctors say just go for thyroid test. That means it is thyroid gland also is controlling against sex hormone. So the sex glands, that's what it is giving importance. And already I told you it is also releasing the calcitonin hormone, helps in maintenance of calcium levels. So everybody knows what is the importance of calcium in our body. It helps in maintenance of bone growth and teeth growth and overall body strongness. When this is affected, then automatically our total skeletal system is getting disturbed. So second function, third function is it helps in control of calcium levels and helps in the body growth. Okay, and other than this, what other functions are there? I am just giving you one slide presentation and you can have a look on that. That is the functions of thyroid gland. Some of the important functions I am just listing out. You can see that slide. And next one, why as a nurses, why we are studying this thyroid gland in B.sc nursing or in GNM? As we are practicing the service at hospital, we should know what is normal and what is abnormal. That is called it as a clinical importance. Why we are studying this one and where you are going to apply means we are going to apply in the hospital setup, and we should know that what kind of problems will occur to the person if thyroid levels are increasing or if thyroid levels are decreasing. So thyroid levels are increasing, the condition we call it as a hyperthyroidism. The levels are increasing. So clinical importance. So I am going to strike up this. Then I am just giving you already functions I have listed out, and I am going to give you just clinical importance because words are little tough. So clinical importance. So that is very important thing you need to understand is hypothyroidism and hyperthyroidism. Hypothyroidism. So the word itself is saying hypo. This is the clinical importance. The word itself is saying hypo means thyroid levels are less. Thyroid levels, T3, T4 levels are less. When T3, T4 levels are less, what pituitary gland is doing is it is releasing a forcefully thyroid stimulating hormone for increasing the T3, T4 levels. It is continuously, constantly pushing the thyroid gland to release T3, T4 levels. If it is not releasing, then thyroid tissue starts growing. That is the condition we call it as a goiter. And this condition we call it as a goiter. And in the functions, if you read, I said it helps in the balance. If hypothyroidism is there, if thyroid levels are low, all our vital signs will be low. All our vital signs will be low. Best example, my mother, whenever I will go for routine checkups, always her BP will be less than 100 or 110, always. Then only we came to know that even her heart rate also is very low. Then she is very weak and sometimes she used to sit some places, but she is a very active person. But when we come to know that this is a problem, she don't have any other anemic or any other conditions, but she has a problem with it, hypothyroidism, and she become very dull in nature. So that is the characteristics of hypothyroidism. That's what I am giving a clinical example. Okay, and so when all heart rate is low and they are very weak and their bone facility is very high and they are getting a high risk of getting some injuries, all those things, then we have to give supplementation compulsory because it is not produced from the thyroid gland. So we have to give hyperthyroidism means we can understand the opposite to that. They are very active and they will have palpitations, means heart rate they themselves can feel. So that's a major differences you can see why thyroid gland we are seeing it. It's the clinical importance. Okay, and if you really like my class, please do subscribe and give me suggestions on which areas I need to improve so that my teaching should be useful for somebody. Thank you.